Thank you for joining the AAKP National Patients Meeting. I'm Ed Hickey, Vice President of AAKP and Chair of the Veterans Health Initiative. I'm a former Marine Infantry officer and I'm an attorney in Los Angeles, California. I'm active in the Armed Forces legal community here in California and work with the Veterans Legal Service Project of the LA County Bar Association to support the legal needs of active duty military personnel, reservists, and veterans. I'm also a former senior aide on Capitol Hill and a former senior advisor to the Director of the United States Civil Service. Like many of you listening today, I have a history of kidney disease in my family and have direct experience as a caregiver. I'm also a kidney patient and share the same sense of urgency to impact research and innovation to save and improve lives and reduce suffering. In 2019, AAKP launched the Decade of the Kidney. Our stated goal and objective is to help deliver substantive changes in kidney research and innovations in the next 10 years. In order to do this, patients must be involved in both research and communications, and we need to share our insights and personal stories more widely. Over the past several years, AAKP patient advocates have been highly successful in getting their viewpoints published in peer-reviewed medical journals. By doing this, we are impacting the research and medical communities. A major factor in this success has been our friend and ally, Dr. Ranish Mahorda, editor-in-chief of the Clinical Journal of the American Society of Nephrology. Under his leadership, C. Jason launched a strategic initiative that established patient voice editors and patient voice editorials. Based on metrics that measure media and social media impact, the patient editorials appearing on C. Jason are among the most impactful that C. Jason has ever published. We thank Dr. Mahorda and his C. Jason team for elevating our voices across the kidney community. Beyond medical journal, AAKP patients and allies are also impacting public and policymaker perceptions about the role of patients in kidney science and innovation through published books. And that brings us to our panel today. The individuals you will listen to in this session are AAKP members, board members, and allied medical professionals who have used their talents and the power of the written word to author well-received books and forthcoming books. Their topics range from kidney science and learning to very personal and emotional stories about their direct experiences with kidney patients and kidney disease. Each of these authors has our deep respect for their intellectual honesty, courage, and sheer guts to get in the public arena and share their viewpoints. I hope those of you who are watching today are inspired by their example. I encourage everyone listening to try your own hand at writing and publishing. Whether you write a letter to the editor, a blog, an article for a medical journal, or a book, the time is now to tell your story during the Decade of the Kidney. For today's session, Authors Corner, AAKP patients and affiliates advancing care, research, and shared decision-making through published work. I have the honor of conducting a series of interviews that we are privileged to share with you now.
The title of my new book is I Didn't Die Yet, and it is the story of my life and my sister's lives after I donated one of my kidneys to one of my sisters after I had turned down the other sister when she needed a kidney. I was afraid I was going to die. I was terrified. I had never had surgery and I had never had anesthesia. But the story of our lives with transplants is to help with what is now being encouraged to people who are in kidney failure. A preemptive transplant is what they're calling it, and it is when a person needs a kidney and they are supposed to search for a living donor before their kidneys are in complete renal failure. And it's very difficult to ask and to find a living kidney donor. And I hope our story inspires others who are in the same boat we were all in, and it could help them understand the whole world of transplantation. Definitely my family is what inspired me. What stunned me was the readers of my first book, and in some ways, I Didn't Die Yet is a sequel or a continuation of our story. The Reluctant Donor was my first book. A lot of the readers have said that I put into words what they have been going through. And if that helps somebody understand what kidney disease does to patients and to families, that's my goal. I have been called the messenger by my sister because I'm telling the stories of our families, and our family's battle with kidney disease goes back 80 years. AAKP used to be called NAPHT, the National Association of Patients on Hemodialysis and Transplantation. So in the early 70s, my dad and my uncle were all part of organizing kidney patients. At that time, it was to help with the cost of dialysis. And they were the first group of patients that went before Congress and dialyzed a patient on the congressional floor. And my uncle and my dad were a part of all that in the beginning. And I was a young mother then, and I lived in Florida, and I used to type the newsletters for the early NAF, which was the early years of AAKP. My dad eventually served on the board at AAKP, which is what I have done for the last 8 years. And it's an honor to be a part of this organization, because if there's one thing I hope anyone listening really understands is AAKP is for the patient. So I'm an old timer with AAKP, starting when I used to type those newsletters on my old Smith Corona typewriter, all the way till now, where we're doing amazing things at AAKP compared to the way it was run back in the early 70s. And I'm honored to be here.
I hope these interviews inspired you as much as they did me. And if you have not yet had the opportunity to read these books, I encourage you to do so and keep a lookout for those coming soon.